Welcome to today's live webcast on business disruption. This episode is on when is it safe to go back to business. My name is Steve Waite. I'll be your host today. For those of you who don't know the Business Centre, we're a not-for-profit organisation with a 35-year history of helping small businesses. This webcast today is brought to you by the New South Wales Government's Business Connect program, and it's for us to look at business disruption. It happens in our society, in our personal lives at any time, but perhaps this is quite unprecedented and will affect change and disorder, and perhaps will change our workplace and our businesses forever. Today we'd like to review this from a perspective of the small business owner, and what do we have to do that? We've got two very special guests, Kerry Walker from SafetyWorks and Craig Dalton, a public health physician, who I'd like to introduce both of you to now. We're getting through a period, I guess, of profound change and disruption in business, and getting back to business is the focus of today. How do we do that safely? How do we do it sensibly? And how do we cut through what is very complex in some ways from a health perspective and a legislation perspective, but we're hoping with our guests today to get some practical insights. So joining us first via Zoom is Craig Dalton, Conjoint Professor, University of Newcastle School of Medicine, and Public Health and Senior Physician, Public Health, Hunter New England Health, New South Wales. Craig is trained as an Epidemic Intelligence Service Officer with the Centre for Disease Control in the US, and runs the flu tracking program across the state and across the nation. Craig also publishes many articles which are very informing, one of which I think I would highly recommend in regards to public health, how not to piss off the community, which seems to be a very popular way of, I guess, looking at this with some of the frustrations. Our second guest expert today is Kerry Walker, Founder and Director of SafetyWorks. Kerry is an experienced safety professional and business consultant with strong leadership and strategic organisational culture and communication skills. Kerry is co-founder and director of SafetyWorks Group, one of Australia's leading providers of holistic safety wellbeing culture change solutions. Kerry's experience lies in translating an organisation's health and safety and wellbeing, values and goals into a business-aligned strategy. Her industry experience in engineering, design and operations management for global resources companies gives her the capacity to analyse issues with a pragmatic approach to developing solutions. In over 20 years of consulting, Kerry has applied this effect across all levels of wide range of leading organisations. Her aim is the culture of care becomes an enabler of business success. To achieve this, she is constantly seeking to make safety processes engaging and a way that people can participate in them, thereby enhancing their effectiveness, safety and wellbeing outcomes. So we'll have live questions today as usual, which will come through. And Craig and Kerry are both very committed to giving us answers and responding in the best way possible to those questions as they come through. Should we have some questions that we can't cover today, we'll record those and we'll speak to Kerry and Craig separately and get to them then. But I'd like to set the scene. A small business is a workplace, it's a microcosm of society, it's a diversity of factors and settings and physical location. But small business owners spend many hours in their business trying to keep their business alive and successful, and they work with customers, they work with their staff, they work with families back home, and so it's a very complex environment. This is a unique occurrence, and it's been a big threat to human health and to business, and I guess as this pandemic moves towards whatever the new normal might be, it's going to be increasingly important that we understand, and Craig greatly informed us of this, that we're probably going to be having to face this for quite some time. So the changes and the adaptations that we make for our customers, for our staff, are those that we may have to live with going forward. So it's important that we understand those risks. First question we always ask though, and I'll ask it of Craig first, is how are you dealing with this in regard to the impact on you as a professional, on the business in which you work in, or the organisation you work in, and just on your own ordinary life? What's it like, Craig?
Yeah, look, it's been very interesting, Steve, and thanks for inviting me along this morning. Of course, we did the 2009 pandemic, and that was interesting and busy, but we fell over after about 5 or 6 weeks of response in many areas, and then we just had to stop because it spread so far. So this disease has been quite different because we can actually contain it, and it's done quite well. But I don't think anyone working in public health had any time off for about the first 8 weeks, and even before got here, lots of preparation, and then come mid to late April, there was this kind of impending sense of doom as we saw the cases rising exponentially, including the unknown source cases. So that was really scary. And we really weren't ready to face it, I think, as a nation at that stage. So we're very lucky. And it was particularly the border controls, I think, that stopped the force of infection of the cases coming in. And then the social distancing, physical distancing, which really put a lid on it. And now we're in this lucky position. We've had a lot of time to prepare and exercise the response, and everyone's feeling a lot more, I guess, a lot more confident. And there's not this sense of impending doom that we had in late March. So I think
What
we're
was
all a
it
lot
like?
happier.
What was it like, if you don't mind me asking, inside the health system, with your colleagues, and what you witnessed and what you saw? What was that like as a workplace?
Yeah, look, I think a lot of people were very scared about what was coming down, particularly looking at what's happening in Italy. There probably was a concern that we weren't closing down fast enough, but it's always hard to know what is fast enough. And in some ways, I think the studies show now that if we'd shut down a week later, that we might have had a much, much bigger pandemic because it was exponential. We might still be trying to close it down now. But of course, the community were asking for things to be closed down. So maybe that was a good compromise, to wait till people really saw the threat and wanted things closed down. But I think a lot of clinical folks in the front line were fairly fearful about what they were going to face. But at the same time, there's this absolute feeling of solidarity, and people recognising that a lot of things that couldn't have been done in the past were very rapidly done. A lot of walls were broken down, and people prepared quite rapidly and very collegially. So that was great to see.
Oh, thank you, Craig. I'm going to call on Kerry to give us an insight for you. What was it like for you and SafetyWorks and for your daily work and your life?
Yeah, well, I guess for everybody it was a bit of a shock. As a health and safety business, SafetyWorks, we were talking about it fairly early on.
Yes.
And aware of it, and really it was about two particular aspects to deal with, and one was caring for our people first and foremost, and that's one of our values. That's one of our key values. We've got a diverse team, like most small businesses. We've got some people with young children. We've got someone on the team who is pregnant. We've got people who already work part-time. So it was really about trying to be flexible and work with them. And in mid-March, we had a team discussion. And we talked to people. We were in the fortunate position that we could work from home as a consulting business, although we do have a lot of interfacing with clients.
Yes.
And the uptake was complete. Everybody said, yes, we will work from home. And conversely, Liz and I and the other director and myself have been working from the office, which is plenty of space. So most recently, in the last couple of weeks, we've revisited that through a risk assessment process in the terms of bringing people back to work, talking with them about how that might look in terms of a staged approach, and it's sort of organically working in that way. So a couple of the things that we did during this time, which have been really effective, have been to instigate a daily Zoom meeting between the team, and then also our other director, Liz, has commenced a weekly wrap-up through an email that goes out every week, keeping everybody up to date. And we've had great feedback from the team.
Was that different to what you were doing before?
Yes, it was, because we saw each other a lot, and we had a regular team meeting every 6 weeks or so. We were pretty much in the loop with what everyone else was doing. But not being together in the physical space, not coming into the office, just made a huge difference. But just doing those couple of things really has kept people engaged, connected, and helped with their mental health as well, being in that isolation space.
Okay. I'd like to move on to our next question, which is one that focus around practical steps and advice that we could perhaps share from each of your perspectives. Craig, you from a public health perspective, and Kerry, you from a practical perspective in regard to managing risk in a workplace. So, and resources that you may know or that are available. Craig, you would have had to have navigated through a whole range of, I guess, complex information, which many of our people that we work with would not necessarily have an access to be able to refine and understand in the same way. But when we were speaking to you yesterday, as we prepared for our conversation today, there were some really key insights about the behaviour of this virus and some of the measures that practically came to mind and which are still in mind in regard to low impact interventions that people could do in small business.
Yeah, so I think we're very rapidly learning about this virus. It's all really new. We are learning so much so quickly, and in fact, like national guidelines have been revised about 33 times, I think it is, from January. So every couple of days during the peak, we had new guidelines and new understandings. There's about 300 or 400 academic papers can come out per 24 hours. So it's like a fire hose trying to keep up with it, and different groups are kind of looking through, trying to gauge the new information that's coming through. But it still comes down to a few basic things at the moment.
Yes.
In our office, for example, and in other settings, other office settings that we're investigating if we get a case, what we're finding is that you can actually run an office fairly normally. And a typical workplace office is easy. You can actually go for weeks without anyone being what we call a close contact, as in no one's within 15 minutes of 1.5 metre face-to-face interaction.
Yes.
It's actually fairly easy.
Yes.
Sometimes you need prompts like putting a number allowed in each room for the 4 square metre room. We have all our signs here on every room. And in areas where people congregate, we have little yellow crosses on the floor, which kind of indicate if you're coming into this area, don't stand, within these crosses. Little psychological prompts like that. We've gone to many investigations where there's been a workplace and someone's been a case. And if you review their last 14 days, they really haven't been within 1.5 metres of anyone. And when they've held meetings, it's been via Zoom or one other person in a big room. And that's great. That means we've got no contacts to follow up. So that's doable. And maybe we'll go into this later, but I think, so the baseline physical distancing and enhanced hygiene we've got looks like it will continue to work, but there are some certain settings which are going to be very challenging, which we can talk about later if you like.
Yeah, we did have a conversation about those later, and that would be interesting. But essentially, the work that was done in understanding how the disease transmitted informed what the response was to reduce its impact, which I guess in the paper that you provided to us is quite technical, but essentially going forward, the physical distancing and the hygiene measures that we can put in place for small businesses are still quite effective and robust as in regard to a response.
Yeah, I think with 1.5 metres, not spending hours in rooms and not crowding people, getting the 4 square metre rule, and basic hand hygiene regularly, and of course zero tolerance to people being ill. I think that's probably pretty well embedded in Australian work culture now.
Yeah.
That will protect the average office quite well, but there are some other settings where that alone probably won't be enough.
Okay, yeah, well, and we'll talk to those later. Kerry, to you, when we were talking about this, from your perspective and the methodology that you would apply and advise people around risk assessment and risk mitigation, it's really no different for this particular risk, is it?
That's exactly right. This is classified as a work health and safety risk.
Yeah.
So if you are already practicing risk management, which is a core foundation of the legislation, as well as consulting with your workforce, then taking that next step to applying that same process to managing this, using the hierarchy of control, these controls that Craig's talked about. Working from home is a separation control. The physical distancing is an isolation control. They're very strong and very effective, known to be anyway, in the workplace. And then moving down into more administrative in terms of perhaps having different shift arrangements, different procedures around where people stand, how many people can be in a room together, right through to personal protective equipment such as hygiene. So all of that same process can be quite consistent. So it's not like you have to deal with it in any special, different, scary way. So if you're already practicing that, then it should be a seamless almost transition.
Some of your insights that you shared with some of the clients you've worked with, working with your staff, to involve them in the adoption of the measures that you're going to put in place? Yeah,
definitely. Them being comfortable with how much and how often, how many is really a critical factor. So at each case, and we haven't had to do this a lot because we've had that daily communication. We've kept up to date with how things are working. I guess perhaps one issue is the fact that in some cases we have started to go back to other clients to clients' workplaces, and
Yes.
we've had visitors to the office.
Yes.
Now, they may have different standards and
Yeah.
different procedures and different processes.
Yeah.
So that's where it becomes important to understand what their requirements are
Yeah.
and how that balances with ours,
Yeah.
supporting our people to function in
Yes.
someone else's workplace and
Yeah.
to support them in that way.
And many small businesses won't necessarily have complex policies or procedures or wouldn't have documented something, but I
That's
noticed you
right.
shared with us the New South Wales government has put up
That's
a
right.
strategy. Do you want to explain that to us, how that works?
Yeah, look, there's some resources. We would, as Craig said, there's a
Yes.
plethora of information, and,
Yeah.
and sometimes you feel like it's a wave. But two key areas would be SafeWorks Australia, which is a national advisory body, and
Yes.
it is charged with overseeing the 10 COVID-19 principles from
Yes.
the National Cabinet.
Yeah.
And they've got a range of resources. So that includes a checklist which looks at 6 key areas and how to manage those. And it also, I guess, has some specific areas for particular industries.
Yes.
So if you're in a particular business
Yes.
or industry.
Yes.
So that's really helpful, very easy to find, very easy to navigate.
Yeah.
And then within New South Wales, the New South Wales government also has a COVID-specific website, and it has now introduced a process whereby small businesses can actually, I guess, self-declare them as COVID safe. So they can do a self-assessment checklist as well.
Yeah.
And once they register that safety plan
Yes.
on that website, they receive like a digital logo, if you like, that says they've done that. And that just gives, and that can be publicly used, a series of posters.
Yes.
So they can very visibly demonstrate to people that they have been thinking about
Yeah.
the issues and taking actions around the issues.
Yeah.
And all of that is overlaid with what we would suggest is do that with your people. You don't have to solve this on your own.
Yeah.
Everybody in the team is exposed to their partners and families who are dealing with it. So there's a lot of information to put into the
That
mix.
would be a good, simple strategy, almost an affirmation that probably most people are doing the right thing. It's just that they haven't said it out. As you say,
That's right.
when transactions increase, when more people come to your site or you go out more, you just need to have a way of talking about this is how we are handling
Yes.
this thing and we've documented it
Yes.
in a particular way. Okay, I'd like to move on to the next question, and this is probably more to do with the future. And Craig, this may be a good opportunity for you to share with us some of the insights that we spoke about yesterday about that maybe business models that currently operate may not be able to operate in some industries, and that particular environmental or contextual aspects in regard to inside concentration of people, etc. Do you want to share some of that thinking with us?
Yeah, look, the group of us are going to try and put up a paper this weekend on this subject, maybe something in the SMH, but we've learned a fair bit over the last few months, and we're seeing things evolve. Now, to give you an idea where we are, probably less than 1 or 2% of people maximum in Australia have antibodies to and expected immunity to COVID-19. So that means we're very early on and we can still run a long way. They say 50-60% need to be immune before it really slows down. It may be less than that because of uneven mixing, as in if all the folks who mix the most got fairly immune, that would start to buffer the transmission through the community. We're getting a fairly good reduction just from the basic hygiene and distancing we've talked about. That'll continue. So we'll probably get this blunted response. We're unlikely to get an exponential increase. It'll probably be a gradual increase.
Yep.
But what they're seeing in places with the similar low levels of transmission, baseline, and reasonable contact tracing, social distancing and hygiene, places like Hong Kong and South Korea, we're seeing a pattern emerge. And that pattern is something which everyone knows reproduction number, but you're going to start reading more and more about over-dispersion. And this is about heterogeneity, how uneven the transmission is from people. And basically what that means is that most people don't infect anyone, but some people infect a lot of people. And this is where we hear of these super spreading events. And it's a characteristic of this virus that most people don't infect, they don't pass it on, but a small proportion. They're saying it's about an 80-20 thing, maybe more, that maybe 10% of people could be responsible for 80% of the onward transmission of the disease if you have some good baseline social distancing and hygiene in. So what that means is that you don't get a lot of transmission in your average office workplace. That's fairly safe. but you do get increased risk in special settings. And those settings are settings that are typically indoor, where there's crowding, where there's poor ventilation. And then if there's really close face-to-face intimate contact, and things like singing, yelling, exercise increases the risk. So, and it's a very much big increase in risk. So just talking loudly or singing can increase your infectiousness by tenfold.
My God.
Yeah, exercising can increase the amount of virus you put out by 2 to 4-fold. It can be really increase. So the sort of settings we're particularly worried about, of course, are nightclubs. A lot of people go there to meet other people, so there's increased mixing. Music's loud, so you get close to people and talk. You dance with them, and that could be 70 to 100 times the risk of just sitting in a restaurant with someone by comparison. Gymnasiums are going to be another challenging area. There's been outbreaks in gyms and nightclubs, and it seems to be that you are basically, when you're exercising, there's just so much more air moving through your lungs, so it means more virus can come out, and the velocity of your breathing means that the virus can spread further. So there's been some outbreaks in Korean gyms that look like it's going to be challenging, and the simple idea of 4 square meters and 1.5 meter distance probably doesn't work in those settings. So it's going to be quite challenging. It's going to mean bigger distancing, much decreased number of people, and probably trying to modify the air conditioning or at least ventilation to increase the number of air changes per hour in the room to kind of flush virus out. Yeah, so quite a dramatic change.
So that does obviously have implications for particular industries and particular settings. With regard to outdoor dining or outdoor events as opposed to those types of events indoors, do you see any subtleties between that of risk or management of risk?
Yeah, look, I think it's a huge difference. I mean, obviously it's still early days, there's been a lot of lockdown, and so we haven't had a chance to be sure of this, but we're seeing just, there's so few instances where there seems to be transmission outside. And the thing about being outside is is that if you think that we all have a plume of particles around us when we're talking, even the slightest breeze, a really slight breeze that would be barely noticeable, has a big difference. So, in this room I'm in now, there's probably very little air movement, but as soon as I throw the window open, which I would if it wasn't so noisy outside, then, you're getting this kind of, even just, you can imagine the breeze moving like this, so the virus is moving away. And so really light breezes have a big impact outside. And of course, if you can detect the breeze, it's having a massive impact on dispersing viral particles.
Okay, you've got some really interesting insights as well about people movement and gatherings of people, but I want to just turn to Kerry and just, if I can, Kerry, I'm just going to move along to talking about, how you've applied your knowledge and skills and expertise for helping people mitigate risk. Taking that a bit further from some of the documentation we spoke about earlier, what types of things would you suggest people can do to manage activity based in their workplace? So if you could just draw some of your insights there, some of the settings we're talking about, what type of measures can they do to communicate beyond this is what we do to this is what we do about this particular activity in our particular workplace setting?
Well, focusing very specifically on that particular activity, we did a risk assessment for a client around it, which was a warehouse-based risk assessment, and we broke it down into a process flow. So from the beginning of the process where the product was delivered, then packaged, then moved along a process line, if you like, into 5 key steps, and we did a risk assessment at each step of the way, and we broke it down, and we were able to focus in on what were the key points where there was where the risk manifested most strongly.
So for some businesses, it's worthwhile for them to get back into a trading position, to be able to look at where most of their transaction risk lies in regard to this particular risk, and to set out a way of addressing it to one, protect their staff, protect their business and their business continuity, and also to protect customers.
Yes,
Yeah.
that's right.
Yeah.
So some of these checklists that are available specifically, particularly the New South Wales government one, specifically addresses issues around protecting staff and customers.
Yeah.
So that interface there is manageable,
Yeah.
just like it's manageable
Yeah.
at a workplace normally.
Yeah, and I notice in restaurants, Craig, I'm not sure if you've seen this as well already, that and I saw police in the community that I was in last weekend actually making sure that they were accounting and identifying people who were dining and keeping a record of that. I presume that's come through a process from health about controlling movement of people and identifying people. Would that be right, Craig?
Yeah, I mean, Service New South Wales has all the guidelines and plans, as Kerry's mentioning, that people can look at there and do their own plan and make sure they're in compliance with what they need to do. But I think the oversight's going to become increasingly more obvious over the next couple of weeks. Yeah.
Okay. Craig, I just want to switch back to you for another question flowing on from what you spoke about last. You mentioned to us when we were talking before the webcast today some really interesting and intriguing research pieces around gathering of people in certain places and some of the X's we're seeing on the floor. Do you want to share with us some of those insights?
Oh, just locally here, we have X's on the floor where one of the things that you can do in a workplace is just look to see where people gather. I mean, sometimes you can plan it, sometimes you just have to observe and see what happens. And so we had someone here who noticed where people were gathering, and then they sort of intervened and put little marks on the floor to reinforce that if you're going to gather in this area, here's how much distance you need between each other. And it really made a big impact. Interesting little nudge, how effective these little yellow crosses were on the floor. So that's quite useful, I think. I mean, we've seen it everywhere else, these green dots and everything that are occurring in commercial settings to remind people. They seem to work quite well. Is that what you meant, or was something else?
Yeah, that's what I was talking about. And that's not a difficult exercise, particularly for some of our hospitality events-based businesses to do a little bit of that risk assessment. And it's not a complex exercise to say, well, where are the concentration points, where are the points at which people line up, etc., and to address that. And I think some of the larger corporate retailers have done that quite well. And it's not that difficult for a small business to do the same and give that assurance of safety about the site.
Yeah, I think it's important when you set a new, policy up or procedure to be careful it doesn't induce crowding. So sometimes if there's screening at a front door or something like that, there's been instances where, particularly on rainy days, everyone crowds together in a big huddle while they wait to get screened, and so it kind of defeats the purpose. So thinking through that, and as Kerry said, using staggering of timing, just noticing that, thinking about, well, let's spread something over 2 hours that would normally be a half-hour thing, so we don't get crowding.
Now, that's a really good insight about weather, its impact on it, and concentration of an event. If you spread time, you can reduce risk. These are real practical strategies that we thank you for bringing to the table. I'm conscious of our time, and I know, Craig, you've got some pressing things happening in the real world in regard to what you're doing at the moment as well. And I'd like to, if I could, just move us forward to thinking about some of the key strategies that you could perhaps suggest. And I'm going to turn to Kerry first, if that's all right, Craig, and then come back to you. But Kerry, are there any strategies, just from your professional experience, that you could share with our audience in regard to, what can you do, what can you find to help you, what would you suggest?
Yeah, well, I think firstly, using the resources available. You don't have to reinvent this yourself. There are many people who've been working to do this. As Craig said, 33 different versions of policies in the last 3 months is very rapid, but they have gelled into some very useful tools and checklists, and they also are able to demonstrate that you've done that. So don't try to tackle it yourself. Use the resources available. Approach it like another workplace risk. I know that's really difficult to say given the emotion around the issue and the disruption that it has caused, but I think applying a process that is tried and proven in managing any other risk, whether it be asbestos or work at heights or excavation, this is really just approaching that in a similar way. Identify, assess and control. Consulting with your people is really important. Consulting with people who are already doing things, consulting with your customers, if you're interfacing with them, but mostly your own team as a small business, and then asking for help. You know, if you're not sure, then asking for help, and that's available, as I said, through SafeWork Australia, through SafeWork New South Wales, or we've helped a number of our clients as well.
Okay.
So,
We've got one question come through that I just want to get to. I've got a few there, but I just want to get to this one before I let you go, Craig. So John from Adamstown has asked, so can I safely encourage my customers to come back to my cafe if we are following the guidelines? People still seem hesitant to come out. Craig, you got any thoughts?
Yeah, I think, absolutely, it's fine to encourage people. And I think, you know, the average cafe is fairly low risk. Interesting thing, which maybe because I'm getting old and it bothers me in cafes and restaurants, is the really noisy ones. So I reckon that'd be interesting. That's one of the things I think would be interesting to try and intervene in with cafes and restaurants, is how to keep them quieter so people aren't yelling.
Because of the risk,
Yeah. So it's an interesting issue, which, you know, we tend to think of the cafes and restaurants as fairly low risk because there's no exercise. There's usually no yelling like you get in a nightclub. But, you know, I think there's the 4 square metre rule and there's the 1.5 metre distancing recommendation, not enforceable, which is possibly unfortunate, but it's also hard to do. But even if you can set up your table so the heads of people that are there are about 1 metre apart, that would make a big difference in terms of risk. And of course, if you're able to have flow-through ventilation, that makes a huge difference, you know, compared to being close and stuffy. And I think in winter that's going to be a challenge. It probably means heating bills are going to go through the roof. But it's making those changes which are probably important.
Okay. I notice in some of the reading that you provided to us that there'll be this sort of dual effect, I guess, of people better handling hygiene and distancing on the traditional flu season. We may get a benefit, perhaps. Is that possible, do you think?
It's definitely happening. This time of year, we'd normally have about 1.2% of people with cough and fever on our flu tracking analysis, but it's dropped down to about 0.2%, so only 1/6, you know, so really low. Last 2 weeks, we've started to see the kids and the young adults cough and fever rates go up. So and it mostly seems to be common cold viruses when we look at the laboratory data. So that's what appears to be starting to circulate. And it probably means that's more infectious than COVID-19, and that'll spread first. Okay.
Just before we get you to we close, can you give us any tips? And you've given us quite a few along the way about yelling and distancing in a really practical sense. But have you got any other tips that you would leave with us?
Look, I think it's all about just think about how do we keep people. When are people getting close face to face, and trying to minimise that happening, and then the duration of it if it has to happen. And then there's a nice safe work physical distancing at the National Safe Work website, which just steps you through so logically. So if it has to happen, make it as short as possible. And if you can't make it very short, if it really has to happen, consider PPE. So you just imagine that very rarely there's this close face-to-face, if it's lifting something heavy, then we use masks or a face shield or something like that. But I'd really recommend that in those settings, think about using masks and face shields, because together that can really, really reduce the risk. And also, can this be done in a well-ventilated area? With all of that, that's probably 100-fold or more reduction in risk, those sort of simple interventions.
Okay, and I have to ask the question, I know the jury's out in regard to empirical research, but what is the story about masks?
Look, so Australia's a bit of a standout, and I think perhaps in terms of worldview on this, I think there's a concern that use of masks may backfire in terms of false reassurance, but there's not much good data on that. In fact, there's emerging data suggesting that if you have a mask on, you actually distance more. And there's also concern about inoculating your hands from the mask, but that is a theoretical risk, but you can also inoculate yourself without a mask. So I think if you look at the literature, most of it is very pro-mask. And I think the latest fact sheet the government put up on 28th of May, the tone is not pro-mask, but it's acknowledging there are places where it may be used, and particularly I think the place it may be used and well defended is in peak hour public transport, where to get that working again, unless they can increase ventilation a lot, that may be where masks would be of use.
Okay, we've got one more question come through I think is useful, Kerry, if you don't mind. We're getting a flow of a question. This is Leslie from Maitland, and it's something that you also spoke with us about before today, Craig. How long is this going to be with us, and these, this social distancing? How long will this whole thing be with us? And I think you had, for me, a very sobering, sense of where we might be at with this.
Yeah, well, if you say that we need 50% herd immunity to really stop it, suppress it a lot, not completely stop it, but still be transmission then at 3% a month of conversion of people getting immunity, that would take probably 18 months. It would take a fair while to get there. So that's a long time. You might say we might get, if we had 3% transmission a month, that's the sort of transmission you get in a community when there's a lot of disease. You might see 10 to 12 months that there would be some blunting of effect just from herd immunity. So I think it's probably, I suspect we're going to have to maintain physical distancing for at least through this winter and probably next winter. I think it may lessen a little over summer, but probably next winter we'll still be facing physical distancing and enhanced hygiene and decreased gatherings.
Yep. Kerry, is that your experience? Is that what you're giving advice to your clients in regard to how they respond to this?
Yes, and I think, I don't know what Craig would say, but certainly people are saying it won't be until there's a vaccination that we can really have a better idea of the timing, and that the jury's out on that. Yeah. Could I just address John's question as well from before? Yes. I think the government's COVID safe rating system, not rating system, but the COVID safe status that you're able to achieve now, if he is able to put that up on his cafe window, much like the 5-star rating on hygiene and food safety, when you walk into a place and you see that star rating, it does give you a sense of security around that process. And I think that potentially this is why the government has introduced it, is that having that poster up on your wall is an encouragement to people to say, right, okay, these guys have been assessing the risk.
Indeed. I've got one more question, and this is a very interesting one. I run a costume shop. When can I safely allow people to try on clothes? Any thoughts on that, Craig? And then Kerry, you?
Yeah, interesting question. The virus probably doesn't live very long on fabrics compared to, it lives longer on, hard surfaces like stainless steel, plastic, that sort of thing. So on cloth, it tends to dry out more rapidly. And so, you could potentially do something where you have a daily turnaround. So something that is tried on one day can't be tried on until the next day or something like that. You could have a rotation like that, because probably only lasts a matter of hours on fabric.
Okay, Kerry, what would you, process-wise, what would you advise?
Yeah, I think the controls around controlling entry and numbers of people, they're often very tightly packed, those kinds of stores. And also the hygiene practices. I think if we get to a baseline where we say there shouldn't be any disease in a particular environment because of the passage of time, then things can then be put in place to, again, isolate, to use distancing, to manage the entry and exit, and then to manage the hygiene.
Yep, so standard practice, managing risk, identifying it first, managing it, and then communicating to people that are interacting with it in the workplace or in your business. Yeah,
and I think the more it becomes part of normally what people see when they enter a cafe or a pub, which we're all seeing now, this will not be a huge step change. It won't be like these stores are doing it and no one else is.
Yes.
It'll become, it's a natural expectation now.
Yeah, the customer sentiment changes. Yeah,
exactly.
Indeed. We're about to get to the close. I'd just like to give each of you an opportunity, if there's anything that you haven't added that you particularly would like to share with us. And Craig, is there anything further that you'd like to share with us that you haven't had a chance to cover?
Yeah, look, I think it's Look, just on the vaccine, that's really hard to know what's going to happen there. And it may be that we actually reach a level of immunity before the vaccine gets to broad use in Australia, because it'll go to probably many other countries first. And when it comes here, it'll probably go to healthcare workers and then people with underlying immune conditions and then the general population. So you'd be having to say that, August 2021 might be when you'd start expecting to see initial vaccinations. It mightn't be till the end of the year or 2022 before more general availability occurred. So could be a while. And then not everybody might take the vaccine. There may be pushback, as we've seen previously.
Yes. So I guess as you shared with us prior to this, this will be with us for some time. Use the low impact measures that are effective and continue to practice good hygiene and health and safety.
Yeah.
Okay. Kerry, anything you'd like to add?
Yeah, look, I think a lot of the basic rules have been established now. A couple of weeks ago, we hosted a forum of senior leaders that we do regularly, and they exchanged ideas on what they're doing, and a few tips came out of that, some great pearls of wisdom, which would be good to share. I think one of those is asking people, do a survey. If you haven't got direct contact, and often we don't when people are working at home, doing a survey of people and how they're feeling, because everyone's experience is different, and some things can really pop out of that. One of them suggested that held a COVID positive drill. So what happens if? And the more complacent we get around no one's had it and we haven't had it, it becomes more of a distance. So practicing for what if someone has got it, considering what a second wave might mean. So we tentatively venture out and then we get a second wave. How do we manage that? That's looking forward. Focusing on mental health. I think we haven't talked a lot about that, but mental health of people is a huge issue, particularly business owners themselves.
Indeed.
As you said in the opening, not only are we juggling the normal demands, the business pressures of perhaps reduced workload and reduced income and managing JobKeeper and all those other taxation issues. So managing mental health and being positive about that. And finally, not dropping the ball on other risks. It's very easy to become really COVID-centric, and I know in industries like trucking, for example, where the urgency to get food deliveries and toilet paper deliveries, some businesses relax their requirements around fatigue management, for example, for truck drivers. So that may be a short-term gap filler, but certainly not dropping the ball on the other risks of your business, which is tricky in this environment.
Indeed, great insights that come from that group. I'm going to use some of those. That's great. Almost like a fire drill. You do a COVID drill.
Yes.
As if something more
as if someone has turned up and said, I have it, or has come forward, or you've identified it.
It's a great idea. Okay, it's time for me to wrap up this webcast. First, I'd like to thank Craig Dalton and Kerry Walker. Thank you so much for the donation and the generosity of your time. We really appreciate that you prepared for this, but also shared your time, and that's greatly appreciated. We'd also like to say to us, if you'd like to reach out to Kerry or to Craig, then please come through us and we can forward on any questions if we're able to do so. Please like us on Facebook, LinkedIn, or Instagram or Twitter, or Google the Business Centre. If you'd like to know more about the Business Connect webcast or getting business disruption advice through the New South Wales Government's Business Connect program, please Google, probably the best way to do it, and you can get that. Finally, I'd also like to thank very much our techs, AV team, Jono and Tom from Fordtronic, who provide the webcast expertise and technology behind this webcast, and who've been our AV partners over a whole range of projects and who we strongly endorse. Physically safe delivery of information, so these guys have been brilliant. If you'd like to talk to a business advisor here at the Business Centre, as I said, or anywhere around New South Wales, Business Connect is the program that can help you. Thank you for joining me. Thank you for joining us, and we look forward to the next Business Disruption webcast. Thank you. Thank you, everyone.